Hi, Robert Beauchamp for training on the imaging software. Today we're going to be reviewing the general settings menu. So to get into the general settings menu, we go to the options, and then we're just going to go into the setup. So the setup, this is where there are some end user tools that you can utilize. A lot of our technical support team will go in here for a wide variety of reasons, but I'll just overview some of the very basic things that you can, as an end user, modify. So the general tab is on the left. It defaults to the general settings. And if you click on the first tab of the general settings, in here you'll have the main doctor's name. You do have some parameters here that I wouldn't necessarily play with. I would leave this for the technicians to utilize. But if you wanted to play with the regional settings, you could click here. This is where you have your tooth numbering system, and you can choose the American tooth numbering system. You can choose the UK numbering system, or the universal numbering system that we follow here in Canada. And this is where you can set this up so that the tooth numbers will follow the way that you're used to being trained in setting up your statuses and your mouse. You can also choose the format of how the dates are presented, either day, month, year, or month, day, year. This is more about your network setup and how the key is going to be registering the license and stuff, so don't worry about that. If you go to the display settings, now here there's a lot of information. If you go to image property settings, this is really if you wanted to use keywords, you can add keywords in here. If you wanted to label certain images with certain keywords and then filter them out in the future, you can do this. Not many do use this now because of the global library and being able to segment images in subfolders, which I think is the better way to do this. But there are ways that you could quickly extract crowns if you wanted to through a parameter of search. But here you could also have just a crown, and you drag and drop all your best crowns, which I think is the better way to do it. You have also image library settings. So this is where you have two libraries present with every patient. The hashtag is actually their personal images, all taken chronologically. And the global is really a library that is always the same in every single patient, and it's the doctor's or the office's global library to be used for educational purposes. Normally what I do here is I would make sure to choose that this library gets opened first when you're going to be activating, and you can have subfolders. You can have patient subfolders if you wanted to create in the patient's folder. Normally people don't do that. But this is where you can also activate the global folder by default in the image library. So I always activate this because I want the global folder or library to be the one that's visual all the time, not the patient's. So I click here and I would save those changes. Okay, so that's something that I would do. Also, when you're dragging pictures into your global library, you want to make them anonymous. So you want to make sure that it's removing the actual personal data and information on that image, and that's where you do that here. Okay. Other than that, if we're going to be displaying the images, you want to keep the date of the original image. Again, up to you if you did want to have it modified. If you want to add in a date, like the date you're importing images into the library, you could have that option as well. Most people want to keep the original dates that are there. Okay. Status settings. So this is automatically switched to the scheme used in the acquisition. So that's pretty automatic. Every time you go and take an x-ray, you come back, it will be in x-rays. That's something that's normal. We do not want to enable a delete from disk, so do not touch these things. Viewport settings. So this is where now these are your 4 viewports. You can customize colors a little bit here. So active viewports are light gray. So you see this one here is light gray. It's the active one versus the others that are black. You can custom this color if you'd like. You can click on the custom. You can go and click on the color, choose a color that you like. I like to just keep it light gray and black. And the inactive ports, you can also activate a different color. So you can play a little bit with colors here if you wanted to have active or inactive. Okay. See full screen acquisition. So in this area here, when you take an X-ray, there's this feature, if you activate it here, that will blow up the X-ray full screen for a certain number of seconds and then revert back to the FMX and following the sequence of images. So I like this feature. Most people, when they're acquiring X-rays, they're outside of the operatory. The images are far away. So if they want to get a quick 4 or 5 second verification that the image they took is actually getting the anatomy they need, you can activate that here and have the image stay up for 4 or 5 seconds so they have a chance to assess, do I need to do a retake? Did I get the shot that I needed? Okay, so that's by just clicking here. Always remember to save your changes. Okay, and there's all these little choices. Also, some things you might want to do, some things you won't. Like I said, a lot of this is also for the text that come in. Okay, show image name and date when you're moving your mouse over it, and also in the footer of the image, that would be activated here. Auto advance after loading an image. So I like this feature. I check this off. So every time I load an image, it automatically will advance to the next box. So if you wanted to click 4 images and get them up side by side, you just click on the images, click, 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 and they all will just get put up side by side with this auto advance after loading. Okay, so that's something that might be interesting. Positioning, no. Teeth chart, no. Archive setting, no. Magnification. So magnification is something where we can change the size of these boxes in the statuses and also in the libraries. So if you wanted to change it by a factor of 1.5 or 2, you can do that. You can even change the size of the icons here, the button toolbars. You can make them larger, you can make them smaller. You can make these images larger as well. So if you have a huge 60-inch monitor in the operatory, you can make them larger and make it look more balanced. So that's where you would do it here. Save changes. I would exit the software, reload the software, and then the changes should be implemented. Okay. Stamps, you don't touch. Other, not really anything here that I usually use. Sub desktop custom names. So we have here an icon that allows you to have 5 different desktops. And this is where you can now go in and type the name of the desktop. So if you wanted to have 4 Byte Wings Pan, then you would just change the name of that desktop. When you go down to this, it will tell you whatever the number is and whatever the name is when you click on it. So if you wanted to have a quick reference. Okay, miscellaneous settings and maintenance. So this here, again, mainly tech. This is where your tech is going to use a lot of these. I wouldn't go here and touch anything. Modules, again, same thing, wouldn't touch it. Synchronization, again, I wouldn't touch. So that's just some of the basic stuff that you can read through, and you can play with some choices and options in the general settings.